Welcome to the 2020 Public Health Law Virtual Summit. In this session, we'll be having a Q&A, which is hosted by the Northern Region, where there's a focus on mental health, well-being, and broadband access. You can use the chat feature to submit your questions. And if you encounter any technical difficulties during the summit, go to the navigation menu and select the Need Help button. Now I will turn it over to April.
Good afternoon. The Northern Region is so happy to be here today to be moderating and answering your questions on mental health and broadband. My name is April Shaw. I'm a staff attorney with the Network for Public Health Law in the Northern Region. I'm interested in a variety of health equity issues related to economic, racial, and gender disparities. I'm particularly interested in thinking through how multiple inequities intersect to create systemic disparities. Before joining the Northern Region, I was a research scholar at the Center for Public Health Law and Policy at the Sandra Day O'Connor College of Law. And I also worked at the Project on Predatory Student Lending at Harvard Legal Services Center. And prior to that, I was a senior law clerk at the Arizona Court of Appeals. Jill Krueger serves as the director of the network's Northern Region. Her legal interests include climate change and health, rural health, and mental health and well-being. Jill has taught public health at Mitchell Hamlin School of Law in both in-person and online settings. Before joining the network in 2010, Jill worked at Farmers Legal Action Group and at the Minnesota Attorney General's Office. She graduated from the University of Iowa College of Law and from Earlham College. Betsy Lawton is a senior staff attorney at the network's Northern Region, where she provides legal technical assistance, delivers presentations and lectures, and builds connections in many areas of public health law. Before joining the network, Betsy spent over a decade working to improve water quality as an attorney with Midwest Environmental Advocates and the Minnesota Center for Environmental Advocacy, where she focused on Clean Water Act implementation and enforcement, reducing agricultural pollution, and preventing drinking water contamination, and represented a broad range of individuals and communities facing water pollution problems. So I'll now turn it over to Jill and Betsy, who will provide an overview of the network and the topics that we're going to be covering today.
Great, thank you so much, April and Mashalawa. We're really pleased to be here and in this online format and as part of the virtual summit. We know that some folks attending the summit may be less familiar with the network. So one of the ways that the network operates is by providing what we call legal technical assistance. So as we were preparing for the summit, we thought, let's incorporate that. We've got this great legal resource, the COVID Policy Playbook, that so many authors from across the country, from different organizations, different academic institutions, and the like have contributed. So we've got this great legal resource, but we know that even after people read some of these chapters, they may have questions about how this might play out in their state, in their local jurisdiction, the tribe, or at the federal level. Or they may want to know, more detail. We only had so many pages for each chapter. So we wanted to have these question and answer sessions. And we knew that it would be hard to address everything in one question and answer session. So we have broken up. There are a number of simultaneous concurrent question and answer sessions happening this afternoon. This particular one is an opportunity, particularly for those who are really interested in law and policy strategies to address mental health and well-being, or law and policy strategies to increase broadband access. We are open to questions on other topics. If you have questions on some of the other topics being addressed throughout the online summit, you may be able to hop into one of the other question and answer sessions to if you're squarely on topic there, you may find people who've been more focused on those issues, but we're open to questions across the gamut, particularly maybe questions that arise from the 8 states that we serve in the Northern Region, and you can see that on our network map. Okay, I'm going to go ahead and share some slides. Thank you. Someone, I think, just helped me. Are those showing up for everyone? Can someone just confirm that? Did that work? No?
No, not yet.
Okay, maybe I did that wrong. All right, share screen. And here we go. Did that work? That looks like it was successful. Okay, cool. So, and I will also note that we've added the files for the chapters from the policy playbook for these two topics in the files for this session. So you may also jump over there and get a sense of what we've addressed in the chapters and see if that spurs any follow-up questions people may have. We thought, just to give people a little bit of time to collect your thoughts, maybe people are coming to the session with specific questions, and we did have some questions. I presented earlier on the mental health chapter. We did have some questions that I didn't get to in that session, so I can certainly address some of those. If any of the people who asked those questions are online now, I can address those questions. Betsy, I think, can anticipate some questions that might arise from her session on broadband access tomorrow. So I certainly encourage folks who are here now to check out that session tomorrow. But so we just have a couple of slides to kind of give you a teaser, an overview, and then we'll go ahead and jump into the actual questions that people are bringing. Let's see. Oh, there we go. So you're seeing all of us. There's all of us again. We all work in our northern region, which is based in Minnesota and serves Wisconsin, Minnesota, Iowa, North and South Dakota, Wyoming, Montana, and Idaho. So we have a geographic focus as well as a subject matter focus, but we're open to questions from any state on particularly mental health and broadband, but really any question you might be bringing today, and we'll do our best. So I'll be talking or happy to respond to questions in particular about COVID and mental health concerns that may have arisen or potential opportunities. And these are some of the topics that we can talk about. The importance of addressing the social determinants of health, those practical considerations, whether it's economic considerations, people might be concerned about paying their rent. Will they have access to unemployment insurance? If their kids aren't able to be in school, will they be able to take family leave? If they have to care for a family member who falls ill with COVID, can they take paid leave? Some of those social determinants may be critical to someone's mental health. Are they concerned about discrimination, racial discrimination? Are they experiencing racial trauma, not just related to COVID, although in part related to COVID, as we're seeing extensive disparities in communities, both the case rates and the mortality rates based on race and ethnicity, and also related to police violence, which has been a co-occurring epidemic with the COVID pandemic. We can talk about strategies like psychological
Well, it looks like we might have lost Jill in her presentation. So while we try to contact her and get back to the presentation that she was just providing, her brief overview of mental health, I'll go ahead and jump into a brief overview of broadband issues related to public health, hopefully to get the discussion started here. As Jill mentioned, tomorrow I will be speaking more broadly in about a 20-minute discussion on broadband and COVID and the need to have widespread accessibility for purposes of public health at about 12:15, I believe is the time for that. So hopefully some of you can join me there. But I did want to just take a few moments here to set the stage for purposes of this discussion with a brief overview of the relationship between public health and the digital divide. Let's see, so why are we worried about access to broadband in public health? Broadband is so tied to public health that it's sometimes called the super determinant of health. And that's because it significantly impacts all of the social determinants of health. And broadband equity is critical to achieving health equity. So for those of you that may not be familiar with the social determinants of health, these are the conditions and environments in which people are born, live, learn, work, and play. And they affect a wide range of health outcomes and risks. So for example, without broadband access, educational opportunities for children are widely diminished. Children may not be able to complete their homework, they have higher learning loss, and now during the pandemic, they may not even have access to classrooms as instruction has moved online. The lack of broadband can also affect economic stability, limiting job seekers' ability to find jobs and apply for jobs. And in the pandemic setting, even keep their jobs. So unlike other essential infrastructure, broadband is largely provided by private companies without significant federal oversight over prices or infrastructure development. And that's led to two main reasons why households lack broadband. First is the lack of access. This means that the technology or the infrastructure hasn't been developed in certain areas of the country where telecommunication companies may not consider it to be profitable. The other issue is affordability. Sometimes broadband is just too expensive for households. And this can be a particular problem in areas that only have one choice for broadband access. There's only one company that provides access and has total control over prices. So how big is the digital divide that these issues cause? We'll delve a little bit into this a little bit more later, but as a preliminary matter, I think it's worth mentioning that it's not entirely clear how big the digital divide is. We know that there are a lot of households in the United States that lack broadband access. By some estimates, that's up to 40 million households. The FCC has a much lower assessment of how many households lack access in the United States. But we do need additional data to really understand the extent of the digital divide and prioritize actions to address the lack of access and the lack of adoption. So Congress took action on this year and via the 2020 Broadband Data Act that instructed FCC to collect some additional data so we can further understand the extent of the digital divide. Even FCC's most recent data, which by some estimates is an undercounting, shows really for a fairly alarming numbers of households in the US have not adopted fixed broadband. So adoption rates in urban areas are only 70%. They're lower in rural areas at about 60%. And on tribal lands, adoption rates are 44%. So less than half households have broadband adopted. And there's also significant disparities in the adoption rates in Black, Latino, and Native American communities. Black neighborhoods have much lower rates of home broadband adoption than white neighborhoods. And over 30% of Black, Latino, and Native American households with school-age children lack home broadband, which can have a significant impact on educational opportunities for children in those households. And the COVID pandemic has heightened the need for internet connectedness. We know that employment and educational opportunities have moved online. Individuals are increasingly relying on telehealth to access healthcare opportunities. And at the same time, opportunities for public Wi-Fi access are limiting. You can't as often go to your local coffee shop, buy a cup of coffee and get online. And libraries are sometimes shuttered. And that's a public access point for a lot of folks who don't have home broadband. So what has been the COVID response? So the federal and state and local governments have all taken a variety of actions to ensure broadband access during the pandemic. Some federal laws have created new funding streams for schools and telehealth. And the FCC has made efforts to encourage private investment in broadband expansion and also secure voluntary commitments from broadband companies to prevent service providers from dropping households who can no longer afford to pay their bills. And to also open Wi-Fi hotspots that create more access throughout the country. We know these policies have had some impact, but they may not have led to the widespread equitable access that we need for broadband. So education, I think, is a really good example. While some children can access their classroom from their dining rooms, other children, those that don't have home broadband, may be left during this fall semester walking, driving, taking the bus to access their classrooms from parking lots or sidewalks of libraries. And that can create a really significant disparity in educational opportunities. So with that really brief background, I'm gonna pass it back over to Jill because I believe she's back on here to talk a little bit more about COVID mental health and the law.
Thanks, Betsy, and I apologize for that. My connection got dropped, but I am back on. I haven't sorted out video, but we'll go ahead with audio. So I think I was in the midst of talking about psychological first aid as a strategy that really can be a universal intervention. It can be used and it can be delivered. It's typically been delivered, I think, historically in person, but it can be delivered as an online modality. It was developed initially through funding under the Pandemic All Hazards Preparedness Act through PROCs, Public Emergency Research and Learning Collaboratives. I may be getting the acronym a little bit jangled, but based at academic centers, typically schools of public health. And so a number of training curricula and including online sessions were developed for psychological first aid, and given the name first aid, that's what it is. It's to address some of the mental health impacts when there's a natural disaster or a disease outbreak. And the kinds of things that psychological first aid, it can help people both help themselves as well as those they're serving directly. And it's not just for mental health providers. It can be help for healthcare providers, first responders, teachers. There's been success with high school students. So psychological first aid is something that, again, a training intervention that can help people with skills that can help them themselves or help others feel more calm, feel a sense of safety, and a sense of, it helps people who may be sort of in a crisis mode, having trouble accessing some of their problem-solving skills, and help create that sense of self-efficacy, not solving problems for people, but helping them tap into that knowledge they already have about how they might solve a problem or resources they might tap into. It can psychological first aid helps people think about strategies, about connecting with others, and it can help promote hope. So it's a really excellent tool, and it's one that local health departments and healthcare coalitions have utilized, I think, with good success. Another tool is the crisis counseling program, which is, again, and typically it's been in, for example, a state where there has been a natural disaster. Currently we have major, we've had in the COVID-19 pandemic, major disaster declarations in all 50 states. And through, a presidential directive that did open up access to the crisis counseling program funds for those states that have requested it. And so that's a program that can provide individualized mental health counseling and can provide financial support for that. Another strategy, there's a whole set of strategies to increase access to care for mental health. I think the big innovation in the COVID pandemic has been enhancing access to telehealth, including telemental health, by waiving the Centers for Medicaid and Medicare assistance in particular, waiving some of the requirements in terms of the platforms on which telehealth can be delivered, so that some of the security and privacy requirements have been waived, at least for the pendency of the pandemic. There are other legal regimens, such as the Psychological Interjurisdictional Compact, which can ease licensing requirements. For example, if there's a mental health provider who's physically in one state, to enable them to provide mental health care to someone who is physically in another state. And that's the Psychological Interjurisdictional Compact is not a COVID specific legal remedy. So it's a strategy that will outlast the COVID response period, and could provide a model for other states to join, a mechanism for other states to join. Right now, it's a small handful of states that are participating in that compact. Other ways to expand access to mental health care include the Mental Health Parity and Addiction Equity Act from 2008, as well as some provisions of the Affordable Care Act. Let's say, if you are a private insurer that provides insurance for physical health concerns, you should provide comparable care for mental health concerns. And that there's been, for a law that's been around for over a decade, there are still gaps in, significant gaps in enforcement and in implementation. So there's still work to do there. We've seen some states, California recently, that have been working toward this. We still have certainly provider shortages in terms of mental health, particularly psychiatrists. And there are some legal strategies there that we could discuss if people are interested. School mental health is a major concern during the COVID pandemic, as Betsy has discussed, the switch to online learning, and part of what that has done is disrupted access to mental health services that are available in the physical school setting. So we can discuss if people have questions about some of those strategies. We anticipate that suicide prevention is something that public health already has made a high priority, as we've seen rising suicide rates in recent years. And there's some really alarming data, including in a recent issue of MMWR in August, showing really concerning data, something, essentially 1 in 4 young adults ages 18 to 24 have seriously considered, reported having seriously considered suicide, during the pandemic and during the month of June. So we can talk about how can we amplify and elevate suicide prevention efforts in our recovery and response from the pandemic. And then finally, just to end on, to make sure that we consider not just responses to threats, but also are there opportunities, even in the many, many difficulties of the COVID pandemic, are there opportunities for growth, both for individuals and at a population level? And there is a field of study of post-traumatic growth, and there have been studies following Hurricane Katrina, Hurricane Sandy, the Ebola epidemic, when there were cases of Ebola 5 or 6 years ago. There is evidence of supports and strategies that can promote post-traumatic growth. The biggest body of evidence relates to veterans and strategies to promote post-traumatic growth among veterans, which may provide some models for us as we continue through the COVID pandemic and begin to recover it at some point. Okay, so we've had Betsy's slide about broadband. I did want to note, as I mentioned, legal technical assistance is a core service that the Network for Public Health Law provides. And we use that term legal technical assistance deliberately. It's a type of service that does not involve actually providing individualized legal advice for a particular situation. or representation. So by providing legal technical assistance in our daily activities through the network or through this Q&A session, we are not intending to form an attorney-client relationship. For that, we would suggest that you please contact your attorney. But this is to provide some brainstorming, potential strategies, some legal analysis that might be helpful to discuss with your own legal counsel, or examples from other jurisdictions that may help spur some innovative ideas that you could adapt for your own jurisdiction. So just wanted to note that this is not intended to be a source of legal advice. If you're tweeting about the COVID virtual summit, COVID-19 law and policy virtual summit, here's some information. You can use the hashtag COVID-19 policy playbook. And beyond that, I think we can just resume. Okay, now I can start video. So I think that is our introductory comments, and we have had some questions roll in. Here we go. So one that I had received and wasn't able to get to in my session, and we'll alternate essentially. So I'll answer this question and then we'll go to a broadband question for Betsy. There was a question, what is the difference between psychological first aid and mental health first aid? So that's a great question because I did talk about both in my prior session. So mental health first aid may have chronologically developed first. I'm not certain about that, but as I understand it, and I understand this not as a mental health professional, but as a public health lawyer. So it may be that a mental health professional or someone deeply rooted in these disciplines might give you a more sophisticated answer. But my essentially layperson's answer would be that mental health first aid is more rooted in mental health care. Or at least a triage approach. So it's typically an 8-hour training that can be provided, and there's, I believe it's the National Council for Behavioral Health here in the United States that's been at the forefront of a lot of the mental health first aid training. And they do tailor it. It can be tailored for, first responders, for rural audiences, for youth, for teachers. It's really an 8-hour training about identifying warning signs that a person may be struggling with mental illness. And it gives skills on identifying those, in having a brief discussion with that person, and then a set of referral resources. And so, for example, one of the laws that incorporates mental health first aid as a strategy is the state of Florida has adopted a law to provide mental health first aid training to teachers throughout the state in order essentially to prevent violence and shootings in schools following the Parkland shooting several years ago. So mental health first aid is really aimed at identifying people who may be experiencing mental illness and referring them for individualized help. Psychological first aid is a more universal intervention that can be intended. Some of the audiences might be the same. It might be healthcare providers, teachers, first responders, and youth. But partly it's to provide people with skills for themselves to help manage their own stress response, because typically with a natural disaster or a disease outbreak, people themselves may be experiencing whatever the crisis is, or maybe, in the case of COVID-19, maybe experiencing concerns about themselves or loved ones, being exposed to or catching the virus. So psychological first aid is a universal intervention, and it's really about some skills. Part of it is focused on saying, sometimes what can manifest and look like mental illness is just a normal reaction to a really awful situation. So someone may seem really anxious or depressed, And in fact, they may be, but it may be because, their external circumstances, essentially warrant that. If you lost your job and, you're not sure how you're going to pay rent and your kids aren't able to go to school, those are all multiple stressors. And so people may, may be experiencing significant stress and significant mental health impact. So psychological first aid says, well, how do we address some of those concerns? Are there resources we can point people toward? Or can we just, by conversation, help them access their own wisdom, re-engage their problem-solving skills? Thinking about, whether there might be a place that they could stay that would be safe, in the short term, or providing education about, eviction moratorium, for example. So psychological first aid both helps to secure initially that sense of safety, might involve coaching in calming tactics, whether that's meditation, mindfulness, or breathing exercises, really re-engaging that sense of problem solving, of self-efficacy, as well as asking people, reminding people the importance of connecting with their loved ones, and promoting hope. So psychological first aid is I would say more skills oriented and more to be applied in the sense of an emergency, and it's more of a universal intervention. And some places where laws related to psychological first aid appear, the Pandemic All Hazards Preparedness Act provided additional funding to develop some of the curriculum. The 21st Century Cures Act provided support for the National Child Traumatic Stress Network, which has also produced resources related to psychological first aid. And then, local health departments or healthcare systems and healthcare coalitions that are receiving emergency preparedness funds may have as a deliverable providing psychological first aid training. So those are some of the ways I would differentiate those two. Can sound a lot alike, mental health first aid, psychological first aid. Is that really two different things or two different names for the same thing? So why don't we turn it over then to Betsy for a question about broadband.
Great. So Betsy, can you explain some of the federal policies that can make broadband more affordable?
Sure. So there are a variety of programs that the FCC has run. They're called the Universal Service Fund programs, and these are long-standing programs that originally applied to make telephone service more affordable for people, but have since the 1930s been expanded to incorporate other telecommunication services like broadband. And the FCC has rules about these specific programs, and these programs are funded via revenue from the telecommunication service providers versus congressional action. So there's funding that's secure in these programs, and there are programs for schools, for individuals, for healthcare providers. And I'll just touch on each of those really quickly. And if there's ones we want to dive into later, we can go ahead and do that. So one of the first programs that I'd like to talk about is the E-rate program. And this is a program that provides discounts to schools and libraries. Those discounts range from 20 to 90% on broadband services. So they can be used for equipment or services for the school. But at this point, the FCC does not allow those funds to be used to provide funding to purchase broadband connections for students' homes. And that is something that could greatly expand the educational opportunities for a lot of households, particularly during online learning. The FCC chairman believes that the current statute, he reads the current statute as limiting his authority to do that. I think there are a variety of different sort of ideas about what the statute does provide. And certainly Congress could provide that authority directly to use those E-rate funds to purchase broadband services for individuals' homes. There's another program called Lifeline, and this program provides discounts for individuals to purchase broadband. It provides a $9.25 monthly discount, which isn't a lot. And that discount can be used one time for each household. It can be used either applied to their cell phone bill or their broadband bill. And then there's an additional $25 monthly discount that is provided for rural residents of tribal lands. And to be eligible for this program, you have to provide income statements or be part of a federal program such as SNAP. And then those are automatically eligible. During the COVID pandemic, FCC has sort of loosened those requirements for applying for Lifeline, recognizing that many people are recently unemployed and may not have a past history of needing this service. And so the FCC has temporarily waived some of those application requirements. There's also the Healthcare Connect Fund. And this program applies to help expand telehealth in rural areas. And it's a 65% discount on broadband connectivity for healthcare providers. And then recently, the FCC started a pilot. It's called the Connected Care Pilot Program. This is a new $100 million program that supports access to telehealth services, and it provides an 85% discount to public and nonprofit healthcare institutions. And this funding can be used for the healthcare institutions to purchase broadband connections for their patients that lack home broadband and are trying to receive telehealth services. So these are the four main affordability programs that the FCC runs through its Universal Services Fund program.
All right, let's turn back to Jill. I'd like to encourage anyone that has any questions to go ahead and submit them in the chat. Jill, what is the best way to combat isolation and suicide risk that's happening because of COVID-19?
You know, there's a number of strategies. You know, in terms of isolation, a lot of the strategies are essentially programmatic. I mean, creating programs, for example, like in congregate living facilities, nursing homes, or prisons, or housing facilities, for example, for persons living with HIV/AIDS. There might be strategies that, like window visits. I mean, this is a whole new strategy that's evolved where people might visit, there can be transmission of the virus through the glass, but it enables people to have at least seeing people sort of in the flesh as opposed to through a screen. And we've seen, certainly in Minnesota in recent weeks, there's been an evolution of strategies. Is there a strategy where perhaps there can be appropriate safeguards put in place where what's called, at least under Minnesota law, essential caregivers are allowed physical access, in a congregate living facility or a assisted living facility. And there is I believe, a separate session on the summit on congregate living facilities. So that's, we're working through this, this pandemic, and as it extends, some of the strategies that seemed, not optimal, but we could live with it for a shutdown for a couple of weeks. As that goes on longer and longer, the toll that isolation and loneliness take, becomes greater. I mean, our former Surgeon General, Vivek Murthy, has written a book about how do we overcome loneliness as a public health threat. So it's a very real threat. Certainly we've seen lots of creativity around using things like this. We canceled our National Public Health Law Conference. That's an in-person conference because you can't have hundreds of people gathering together. so we're doing this virtual summit, and it's a way to combat, the isolation as we're developing our legal theories and our public health programs. So certainly online strategies, a lot of that, again, is programmatic. But so suicide risk, we do have a lot of, I think, powerful law and policy strategies, and I'll just run through a few of them. Certainly at the federal level, the Garrett Lee Smith Act provides funding to states and tribes and localities to implement evidence-based suicide prevention strategies. And those strategies can take a variety of forms. A lot of it might involve kind of teaching and practicing coping skills, for example. But what we know is from studying, comparing the outcomes in communities, states and communities that have received that funding and implemented the suicide prevention, compared with suicide outcomes in states and communities that have not received that funding and not implemented those Garrett Lee Smith programs, we do know that the outcomes are better in the ones with the Garrett Lee Smith programming. So certainly there's a lot of research there, a lot of powerful models that people can draw on. We have there's a lot of research about means restriction. And by means restriction, I mean access to the actual means by which someone might die by suicide. Now, firearms are a major means by which people die by suicide. And so we've had discussion in recent years in the United States. Many of these laws, some were discussed in the context of the federal government, but it seems like it's been easier to muster the political will, not easy, but easier comparatively to muster the political will at the state level than at the federal level. And we've seen that in culturally and politically diverse states. So there's a good deal of evidence on the red flag law or the extreme risk protection order law in the state of Indiana, as well as in the state of Connecticut. So it's a law that can have, based on the evidence, can have bipartisan support. And these laws essentially enable us to through law, through a legal mechanism, through a hearing, providing evidence that someone is a danger to themselves or others, to restrict their access to firearms, which can be a principal means of death by suicide. So that's another really strong evidence-based strategy. So in addition to Garrett Lee Smith, red flag laws, certainly the National Suicide Hotline is an evidence-based intervention, a late stage intervention, but if someone's really contemplating suicide, there's strong evidence that reaching out to that phone line or that text line, in recent years, the growth of text lines for suicide prevention have been proving efficacious, particularly among teens and young adults. So certainly, I would suggest that we've had recent action at the federal level, and April, I know you have a fact sheet coming out on this soon on moving toward changing the national suicide hotline number just to a 3-digit number that'll be easier to remember, and that'll be rolling out over the next 2 years. So if people have more questions about that, I'd encourage them to follow up with April. She's been researching that. So I think those are some really strong suicide prevention strategies that are sort of later along the line, but I think some of those social connectedness strategies about helping to support social connections through online means or through a window if need be. I've seen the term social assistancing as opposed to social distancing. I think that was in a Journal of Public Health Management Practice article from earlier this year. The notion that, that actually is a win in 2 ways, because the person who maybe they have an elderly neighbor or a neighbor that they know has HIV/AIDS, for example, maybe that neighbor is able to go to the grocery store where that person feels, is vulnerable, to go to a grocery store, but someone else could go and drop the food off on their front doorstep. And that's a win in that It reduces the physical risk for the person who gets the groceries without having to go to the grocery store. And perhaps they have a visit through the front door, but also the person who provides that social assistance gains a mental health boost from helping someone else. So that's another, thing that I think, local community-based organizations or even health departments can help facilitate those kinds of voluntary connections. So those are just some thoughts about, addressing isolation. We know that the statistics about a looming threat of suicide, both from the Wellbeing Trust over the summer, as well as in an edition of MMWR, the suicide threat is very real given the precarious economic circumstances so many of us find ourselves in, as well as just the other stresses of the pandemic. So I'm really excited, April, that you're going to be doing a fair amount of work on suicide prevention. And I apologize, I've gone on so long without turning to you, but if you have any comments to add yourself, feel free to do so, or we can turn things over to Betsy.
Yeah, so I guess I could just add with the 988, the FCC's rollout of 988 as the National Suicide Prevention Lifeline number. That is another evidence-based strategy. They put a lot of research into whether or not implementing an easy 3-digit number would reduce suicides and help prevent suicides. And after doing their research, they concluded that it would. So I think that, it's just a further move to adopt these evidence-based strategies that are shown to be effective in addressing suicide risk. Okay, turning back to Betsy, are states and localities doing anything to help expand access to broadband? And what barriers might they be facing if they are trying to expand access?
So oftentimes states and localities are closer to the digital divide. They understand what's happening in their communities, and they have, in many cases, states and localities are pushing hard to ensure that all communities have access to broadband. So states are doing a variety of things, including funding, providing funding to ensure that a wide variety of communities have access to broadband. And this is particularly applicable if there's sort of an inequitable provision of services, and the state can step in and provide funding specifically directed at filling those gaps. States like Minnesota have set statewide adoption goals. I believe Minnesota has a 100% adoption goal, and they usually come with a deadline, and maybe that deadline gets pushed off, but it keeps the state moving in the right direction. States also have something called referred to as dig once laws that encourage broadband infrastructure to be installed as part of major infrastructure improvements. So if a road is being built, the state laws would require an analysis of whether this is a good opportunity to expand broadband, and how that may work in that particular situation. States like North Dakota, I believe, have a statewide network that they've promoted, which helps in states that are fairly sparsely populated. And then many states actually do promote local broadband. And local broadband would be broadband services provided by a state or municipality, a tribe, rural electricity cooperative that recognizes the lack of broadband in a community and fills that hole by providing the service themselves. And the benefit here is that it increases competition. Again, it fills the gaps, it increases competition, and provides a really needed service in a lot of areas. However, there are restrictions on the provision of local broadband services in many states. And that may be because there are arguments against the provision of local services as well. Those are that municipalities or localities providing broadband service is unfair competition because there's a government resource behind the broadband service. That the taxpayer risk of such a service is too high. Or things along those lines, that there may be too limited funds. Is that a priority for a community? And then also that local municipal broadband services could discourage private sector investment in a community. So some states, I believe there's maybe 19 or 20 now that have fairly serious restrictions. They preempt local broadband services. So they either altogether bar localities from providing services, or they create very serious restrictions that really prevent a lot of municipalities or rural cooperatives from even trying because the bar is just too high. And this has been going on for a while. The FCC had to deal with this issue, I think in the 2015 or 2016 time range, where they did issue an order that prohibited states from preempting local broadband. And that was challenged in court in a case called Tennessee v. FCC. And the court came down and said that the FCC does not have the authority to prevent states from preempting local broadband services under federal law, and that states in fact can preempt or restrict the provision of local broadband services. But to date, there are still over 300 municipal broadband networks in the United States. And there has been federal legislation, every year for maybe the past 10 or 15 years that would create specific language in federal law that would prohibit states, would essentially preempt states from preempting localities. So it would ensure that localities have the opportunity to provide local broadband services. Localities also have taken a big step in to promote broadband services during the COVID pandemic. They have taken a variety of actions. They've provided Wi-Fi hotspots to individuals that don't have home broadband. They would open citywide networks to anyone who needs them. School districts are taking actions. They're putting Wi-Fi hotspots on buses and parking buses in neighborhoods that have, high rates of a lot of houses without broadband service, so that students and other people in the household can access the internet when those buses are parked in the community. And then there has been quite a bit of action lately in cities joining in these public-private partnerships where they pay for, the cities pay for broadband connection for households that don't have broadband for students in the community. And that has generally been funded with some of this money that's been provided through the CARES Act to expand education during the COVID pandemic. I think cities like Chicago are paying for broadband service to 100,000 students so that they can get online and learn during this time in particular. So there's a lot of action. States and localities are getting pretty creative in ways to provide services where they lack service.
Okay, great. Thank you, Betsy. Turning back to you, Jill. One question is, how can schools be prepared for students' mental health needs when we have these mass reopenings after, students potentially have been sheltered at home for a year?
Yeah, thanks, April. That's a great question and one that we need to be grappling with now. Some schools have gone back to in-person classes and then quickly gone back to remote, both at the K through 12 level and at the college and university level. But, at some point, You know, maybe it's when we have a widely accessible vaccine, but at some point we hope to have kids back in school. But it's not like we just press, okay, normal, resume. You know, I think it would be unwise to assume that we can just go back to normal. So what can we do now to support kids, teachers, and parents and administrators, both in managing the day-to-day challenges, and what can we do to be ready for that day when kids are walking back through the doors of their schools. And maybe they're doing it with some apprehension, maybe they're doing it with like unfettered glee, you know, to see their friends in person again. And maybe it's, you know, careening back and forth between those two. So I don't have all the answers, but I've been monitoring what, you know, the folks who work, you know, in education have been thinking, have been saying. And I will say that educators have been thinking increasingly about emotional and mental well-being over the years. When we enacted the successor to the No Child Left Behind Act, the Every Student Succeeds Act at the federal level a number of years ago, Title IV of that act was really focused, at least in part, on creating the conditions for student learning, or sometimes that's called school climate. So what are the kinds of, you know, that's, I think, one container we can think about is creating the conditions for student learning. And right now, most school districts, most states or school districts have concluded we don't have acceptable conditions for student learning because the physical risks are too great. So, so we don't have the physical conditions, but when the physical conditions, when the threat of disease is, we've concluded based on evidence that the threat of disease is less, how do we create those less tangible conditions for student learning, those emotional and mental conditions for student learning? And, you know, some thoughts are, you know, about the curriculum, and some are about teacher training, but I'll just march through some thoughts that I can share, and you know, different ones of people in the audience may be able to tap into these at different jurisdictional levels or different points of intersection, whether they're in the schools or whether they're, you know, at a local health department or community-based organizations. Different ones of these strategies may provide different entry points. But beginning with early childhood, in terms of law and policy strategies, we have some measures in place, and the evidence shows that family home visits in the first few years of a child's life, particularly a first child, to parents, to provide education and parenting support to those young parents, and perhaps even support as they're thinking about their careers and their economic futures. We know that family home visiting is an evidence-based strategy. Now, most of those kids, you know, aren't in K through 12 schools, but some may be, for example, in Head Start programs. Head Start itself is a legal intervention specifically targeted at those who have been most at risk in the COVID pandemic. You know, kids from low-income families, from families of color, those communities that you know, have experienced disparities in the COVID pandemic because they tend to be more concentrated in low-wage jobs, in essential worker jobs, where they haven't necessarily been able to work remotely from their homes, but are out interacting with people. So there's greater risk there. There's greater risk of you know, jobs that have been lost and may not be recovered, for example, in restaurants. So Head Start is really a terrific strategy that's really targeted at those who may most benefit from those kinds of interventions. You know, more broadly, I mean, there's you know, a great deal of evidence around universal pre-kindergarten in terms of readiness for the academic skills, but also assistance with those social and emotional learning developmental milestones, when a child is 3, 4, 5 years old. And we know that one of our, allied organizations, City Health, has really worked with some of the largest cities in the country around universal pre-kindergarten, or at least more widely accessible and higher quality pre-kindergarten. One of the challenges, of course, of the pandemic is that, there were some things, some of the gears were in motion to expand pre-kindergarten, but that depends on budget. That depends on, meeting in person to a large extent, or at least the assumption had been, as these plans were being laid. So we already are seeing some jurisdictions stepping back from those commitments to gear up on expanded pre-kindergarten. And we've got to figure out a way to find those dollars to be able to keep moving forward with that, because those really young children whose lives have been turned upside down by this pandemic could really benefit from that pre-kindergarten. So we need to work on that, so that we're ready when kids are able to physically be back in school. The 21st Century Cures Act is another resource for funding for early childhood mental health. Moving on to K-12, trying to be mindful of time. Social emotional learning, I think, is sort of it's a buzzword for a reason. There's the national organization, CASEL, the Collaborative for Academic, Social, and Emotional Learning. They've been working for a number of years with states and districts, school districts, collaborating on how do we expand social and emotional learning. What are the curriculum? What are the policies at the school or school district level? And then what are, maybe the school board policies? What are the state, laws or benchmarks that can help expand this? And CASEL has been really actively working on how do we translate some of this to an online environment. They've done, tons of webinars. They've got resources on their website. Some of those collaborating districts like Austin, Texas have, resources on their web pages. The important thing, I think, with social and emotional learning is remembering it's about the kids and it's about every other adult. We typically say in the building, now we say, in that educational environment. So making sure that there's training and professional development opportunities for the teachers. Some states like Massachusetts already had SEL baked into their teaching standards, their teacher certification standards. We're seeing growth in undergraduate and graduate education training programs emphasizing social and emotional learning skills. So I think continuing with that will be really important. We've seen some pioneering states like New York and Virginia say, hey, we need to make sure mental health is a topic in health education. I think it's a great opportunity for a lot more states to join those pioneering states to make sure that mental health is a topic addressed in health education, whether in the current remote learning format or when kids go back to school. We've seen Oregon adopt a law that kids can have an excused absence for school based on their mental health concerns on a given day, and maybe other states will want to visit that as well. So those are some thoughts. I know we've got a couple other questions that have come in, so I don't want to could go on longer, but let's switch back to broadband.
Okay, Betsy, can you expand on any federal policies that have helped improve broadband during COVID-19 and address whether you think these are temporary changes, or are we looking at it bringing about more permanent changes?
So there have been a variety of efforts I mentioned just generally earlier out of the federal government to try to address the broadband disparities and lack of broadband access, in particular during the COVID pandemic. And a lot of these occurred during the initial shutdown and immediately after in early mid-March and mid-April. And first of all, the federal government provided a significant amount of funding to address broadband disparities, and that's part of the Coronavirus Aid, Relief, and Economic Security Act. That's a CARES Act. And these funding streams were meant to expand rural broadband deployment and to assist schools and libraries during closures as those buildings were shuttered. And the funding is important, but it may not address all of the disparities that we're seeing at this point. So there was about 16 billion between two funding streams that was provided for educational relief. And these went to education agencies to purchase technology, including connectivity to support remote learning. And that may have been used, for instance, in the Minneapolis public schools where my children go to school, there was widespread need for home iPads or computers that could have been used for that type of funding. It could have been, or that type of access. It could have been used to expand Wi-Fi hotspots, etc. There was also $200 million in that CARES Act to expand telehealth access, and another $50 million that went to the Institute for Museum and Library Services to expand digital network access. And then the FCC made its earliest effort to address broadband access was the Keep America Connected pledge, which was a voluntary program that asked the broadband service providers to take certain actions like waiving late fees, not terminating service, and opening Wi-Fi hotspots to individuals who need them. And quite a few telecommunications companies did volunteer to be part of this Keep America Connected pledge. However, those voluntary commitments expired on June 30th. And FCC Chairman Pai has since urged congressional action to sort of step in and ensure that we're not having many more people losing their access as they don't have the resources anymore to pay for home broadband, or they never had the resources to access home broadband. They also made some revisions to those Universal Service Fund programs that I mentioned earlier. In particular, the E-rate program, which is the one that provides funding for schools and libraries. They waived the gift rule. The FCC waived a rule that they have on the books that prohibits private companies from providing gifts to participants in the gifts of broadband access or broadband services to participants in the program. So this will allow broadband service providers to provide free mobile hotspots and broadband enabled devices to schools and libraries. And then that can be utilized to help students and others access home broadband when they lack service at home. But the FCC, as I mentioned earlier, didn't change the authority that it has currently provided for E-rate money to be used to provide home service itself. I think I mentioned that there have been some changes to the Lifeline program. Participants can't be de-enrolled unless they ask to be, because it's very difficult to maybe provide the information that you need to support your participation. Also, they've eased the application requirements. And they have also waived the gift rules for the rural healthcare program along the same lines. So they've encouraged private investment to expand broadband to help with telehealth service issues. These are the main ways to date that we have seen the federal government address broadband specifically during the COVID pandemic. And some of these would be great programs to extend beyond the COVID pandemic. How likely that is remains to be seen, and where that funding, there are certain funding streams, that universal service funding streams, that are pretty consistent that could be used to support broadband access where it's not currently happening. And I think there is anticipation that there will be more federal support in any further relief packages that come out this fall yet, if there is to be any further relief packages.
Thanks, Betsy. I think we have time for one more question. Um, Joe, we had a question about the wildfires on the West Coast and the impact on not just wiping out communities, but the air pollution. And so, this question I think is asking for you to comment on maybe the mental health impacts of climate change as they're occurring right now during the COVID-19 pandemic.
Thanks, April. That's a great question. And climate change is, as you know, an area that we do work on in the northern region. So I'll share my comments and yeah, certainly invite Betsy if you want to add. I know we don't have a ton of time. If you have anything to add, if I miss anything, feel free to jump in. I do think that's right, that the wildfires are as much an aspect of what we do about climate change. We know that mental health concerns associated with climate change, sort of a generalized and specific concern, have been growing. We know that there was data after Hurricane Harvey, for example, that the mental health concerns were some of the most severe and the most long lasting following that natural disaster. So what do we do about it? Well, we know that this really goes to people's sense of safety. Like if they're losing their homes, if I heard about a town in Washington where the sheriff's department was driving down the street, yelling out their window to people to evacuate because an evacuation order, had not been timely delivered. I have in-laws in the state of Oregon, and just the firsthand reports of livestock being, taken to the county fairgrounds, and the county fairgrounds getting full, and, where else can livestock be taken to for safety? So we know that we've already talked about psychological first aid as one strategy to really speak to that sense of safety, to that sense of problem solving. Like, where else, do you have someone that you can go and stay with that isn't, in your immediate community, where you can be safe? Helping people access their problem solving skills and develop, access that sense of self-efficacy, or communities coming together, to open the fairgrounds and make sure that there's going to be water and, a mechanism to keep all of those animals safe. I mean, that takes a sense of collective efficacy. So there are sort of those first, strategies. And I will say that at least in some points along the West Coast, I know that, San Francisco and a number of health departments, Alameda County and several others, have done a lot of work on becoming not just trauma-informed health departments, but really addressing trauma throughout their systems, so that every staff member is trained, whether it's WIC or restaurant inspections or whatever the case might be, if however they're interfacing with that person, if something about concerns about the wildfire comes up, that person has had the training and has the skills to help respond to that, and not become overwhelmed themselves. They have the skills to also help keep themselves grounded. So psychological first aid, certainly. We know that climate change professionals, the association, the American Society of Adaptation Professionals, has been doing work to support those people who are working on climate adaptation day in and day out and feeling the weight of that. They've been working on mental health supports for their own workforce, and we may be able to look to that. We know that there are strategies like green schoolyards. We've been talking, there's been a growth of looking at, if students can't return to the school buildings, might there be a way to use parks or other land masses that cities have to provide outdoor learning opportunities? And I've seen some initiatives coming out of California now with the smoke and air pollution from the wildfires that makes that more challenging. But there's also just a whole movement around green schoolyards, and places like Chicago, where the water utility has worked with the school district. The school district has the land mass. The water utility has some funding to address stormwater surges and ways to get together and say, let's tear up these asphalt playgrounds and create natural playgrounds where we can filter, we can absorb some of that water, provide stress relief for students, and during COVID, maybe facilitate social distancing and outdoor learning. So I think green schoolyards are a great initiative. Psychological first aid. The last thing maybe that I'll say, and again, I think looking at some of that work on trauma-informed systems, particularly at the San Francisco Health Department, for health departments might be useful. The last thing I'll add is, we talk about health in all policies, in public health a lot these days, public health 3.0, cross-sector learning. So I'm gonna throw something out there, healthy soils. We've got, a team of folks at the University of Nebraska Medical Center, Jesse Bell, Rachel Lookadoo, and others have been heading up a national effort to look at drought as a public health threat. And there's also, we've been at the network working with the US Climate and Health Alliance that's looking at policy initiatives that can really move the needle to address climate. And so one of the things we have to say to address wildfires, we need healthy soil. We need regenerative agriculture. What we learn when we look at what causes drought is a diminished carrying capacity for water in the soil. I heard a state climatologist say that, in some parts of the country, we're just weeks away from extended drought because of the diminished carrying capacity of the soil. So strategies like we're seeing in the Farm Bill to promote soil health through conservation measures like crop rotations and management intensive grazing. It can seem crazy to be talking at a COVID summit about regenerative agriculture, but if we can build the carrying capacity of the soil so that it can hold the water when there are heavy rainfalls and storm events, which we're also seeing increasing with climate change, then that water will be there during the periods when there is less rain, and the trees will be less susceptible to these enormous wildfires. We also need, forest management practices and controlled burns and the like. But some of these strategies, some of these cross-sector strategies, and a number of states have adopted laws to promote healthy soils. And the most recent Farm Bill has a number of provisions to promote healthy soils. But that's just a wonderful opportunity to talk in a really real, tangible way about how this cross-sector being informed by these legal strategies from other sectors can actually really help us promote health, both when it comes to climate change and the COVID-19 pandemic. Betsy, I don't know if there's anything you would add from work you've done on water quality and quantity and the tree canopy, or I think at time, but if there's anything I missed that you would add. Sorry, I meant to leave a little more time.
No, that's all right. I think you covered a wide range of things, and it does look like we're at time. So if anyone has questions on that issue, you can certainly follow up with me directly via email.
Great.
Great. Yeah, I think that wraps up our session.
Awesome. Thank you all for all those useful information. That concludes today's session. Please press the button underneath this video feed in Pathable to take the evaluation for this session. Thank you all for attending and have a great rest of your day.
Thanks.